Hi, Eileen. It's nice to meet you. Welcome to the podcast. I'm excited for our conversation today. And
Yes, thank you, Judy. I'm very thrilled to be here and can't
Good.
wait to share some good things. Hopefully that will help people.
Perfect. That's my goal. So tell me a little bit about yourself.
Well, I am a physical therapist by profession, but I have practiced sort of outside the box since I started. I was exposed to some amazing people before I even graduated the college coursework and was mentored and traveled with some beautiful people taking amazing coursework. So my journey is a little different than the conventional PT. And I think
Right.
because of that, I've been able to be more eclectic in my approach. And I've seen a great deal of benefit.
Hmm. I'm really curious. Can you tell me where you might have traveled, what kind of training you added to the pot?
So the first 15 years of my profession, I was very motivated to do manual skills because they work. And I was really blessed to be trained by people in myofascial work, craniosacral work that was a little bit outside the norm. And what I mean by that is a lot of the times when people do myofascial release, they can be heavy handed because they think they need to go deep in order to and I recall one patient in particular, she had an issue that I know was pulling on the low back, and she had a lot of chronic issues, and she'd been kind of wounded by a therapist prior to that. Basically the therapist was working on her and she was feeling like the release was finally going to happen. And then the therapist answered the phone and continued to have a conversation while she was working on the patient. I can't even go there as far as to how unprofessional or uncaring that was. But that's a whole nother story. So she ended up coming to me and I knew that we needed to release the front of the hips, the psoas, that was just pulling on the low back. And I said, I want to do a release. And she said, oh, that's so painful. And I said, no, not the way I've been trained. And, there are ways that you can go deep, sort of like Ida Rolf, if you're familiar with Rolfing, used to say, I trained under Tom Myers, who trained directly under Ida Rolf and Moshe Feldenkrais. So these are like amazing icons in the industry. And he said, yes, Ida Rolf used to say you need to go deeper, but she didn't mean to dig in and cause pain. She meant to impact the body on a deeper level with the work. And a lot of
Wow.
that has to do with almost intentional on the therapist's part. And
Okay.
so it's difficult to explain, but the basic premise is when I'm working on someone, I'm sensing what's happening in their body. And if I feel that their body is starting to guard because of my hands, I know that we need to give the body time. The person has to learn to trust on an instinctive level, the person that's working on their body. And because I have a history of leading a support group for over 25 years for women who've experienced abuse and trauma, I know that sometimes putting your hands on someone can really trigger things. And so you need to be very cognizant of what's happening in that person's world emotionally, mentally, physically, and very respectful, very gentle, and very kind. And sometimes when you go to seek people for pain, that's not what you get. So,
Right.
yeah.
That's fabulous. And it's also all about connection, right? So you're connecting the energy of the nervous system with the body, muscles, everything, and mental. So that's amazing.
Yes, yes. And it's interesting because there is a response that the person can have that is they feel it's like over the top emotional response to manual work, but it's kind of their body releasing the trauma.
Yeah.
And I remember one woman in particular, she had very serious buttocks pain, sciatic pain, piriformis pain. That's a very deep muscle that's underneath all the layers in the backside. And she had no clue why she had this. She'd had the pain for 20 years. And so,
Wow.
yeah, so I'm working with her and I'm seeing, yes, she has a torsion. Yes, she has things. And everything I do is very gentle. There's no high force, high velocity thrust movements. I'm not attacking any professions that do that, but I have found that that's not necessarily necessary in order to obtain improvements. And so I remember working with her and we had everything biomechanically good, like the joints were aligned properly, movement was correct. Yet that piriformis and that sciatic pain, it just wasn't releasing. So I had to do some deep myofascial work to get that muscle to be happy. Now, I don't isolate things when I work with people because they are a whole person, but I had already addressed whole body issues. And this piriformis was just, it had its knickers in a twist, which is the best way to put it. And it really needed some TLC. And
Yeah.
so I spent, oh my gosh, probably 30 minutes just working that one area of the body. And I will always remember this. She started, I don't want to say yelling, but she started calling out saying, "Oh my goodness, what is that? What is it? What am I feeling? I feel blood flow. My leg feels warm. I'm getting this rush down my leg." And she just started crying. And then because the muscle was releasing and blood flow was returning optimal blood flow. Not that she didn't have blood flow, the tissue would have died,
Yeah.
but optimal blood flow was returning because that muscle was releasing. And then she started crying and she remembered that she had fallen downstairs 20 years ago. And that had been blocked, that memory, because she was adamant she never did anything to cause this problem. And here's the sad part. She was beating herself up as she said, "I was wearing these stupid shoes. I was at the top of the landing and I had to hang out clothes and these stupid shoes. I had these stupid shoes on." She must have said that 20 times. And so she blamed herself for that accident. She slipped on stairs because there was dew in the morning and the stairs were a little slippery, and she blamed the shoes and of course blamed herself for wearing those shoes. And I told her, I said, "You got to forgive yourself. It was an accident. You are not at fault for this." So it's really interesting how it's all tied together. And that doesn't happen with every person, but I've seen it happen more often than not.
Yeah, it's so true. Amazing. What led you into, what personal experience shaped your decision to go into this line of work?
Well, when I was very little, I wanted to be a doctor. And I think I just had this urge to help people. And I will say that I did grow up in a very dysfunctional environment. There's a reason I lead the support group.
Yeah.
But I'm completely healed. I am fully whole. There's nothing in my past that impacts me in any negative way, only in a positive way, because I can connect with people who haven't yet healed and I can understand them. And when somebody knows how you feel because they felt the same way, it's very cathartic. But so when I got a little bit older, I realized I didn't really agree with the medical model. And I'm certainly not picking on doctors. Anybody who goes to school for 12 years to help people is a good person. But it's the medical model itself that really falls short, because we're medically manipulating symptoms and blood biomarkers, and we're not looking at the whole. When my mother was toward the end of her life, she had a serious medical condition, and she had all of these different experts, these consults coming in to treat her by looking at her chart. Somebody for the lungs, somebody for the kidneys, somebody for the liver, somebody for and there was no one overseeing her as a whole person. And I know that I worked in acute care for many years in the hospital settings, and I saw that there was this disconnect. I mean, the lungs can't work without the heart can't work without the lungs. I mean, everything's connected. Right. And when a person is in that sympathetic nervous system overload, which means they're running from the bear for whatever reason, their digestive system isn't going to work properly, because you've got this aspect of your nervous system called the enteric, which is what runs the digestive tract. Your brain doesn't digest your food. It has nothing to do with it. However, if you're in this chronic state of pain or you haven't healed from trauma, your digestion will be impacted. And So this disconnect with my mom, it was so sad to watch. And I was doing my best I was there constantly, as much as I could be there. And, getting them to, at one point, and I won't get off on a tangent, but they had prescribed something because of a symptom she had, and that had put her into a full-blown crisis, and she ended up in ICU. And the doctors were scratching their heads trying to figure out what happened. And I said, well, when I was here last night, they prescribed diltiazem. And they said, "Oh, no, they didn't." I said, "Yes, they did." And "Oh, no, she didn't." I mean, "Yes, they did." And when they checked the chart, they saw they gave her diltiazem. And that's what bottomed out her pressure. And it's a big, long story.
Yeah.
But, it's hard to be an advocate for a loved one when you're battling
The system.
Yeah. So it's much better to work toward not ending up there.
Yes. I've been there, believe me. And I always suggest do the research. Don't trust what you're told. Just do the research and look for yourself.
And people, they get a little overwhelmed by that, because I recommend that as well. You really need to be informed. That is one of my passions. And in my books, I talk about that. You've got to be informed. I've got whole chapters on risks and benefits of the common recommended treatments and all of that. And people say, well, I'm not a doctor. I don't know anything about medicine. And I tell them, did you do research before you bought your house, before you bought your car, before you went on vacation? You saw what you wanted. It's the same thing with medicine. You don't have to understand it. But the $1,000,000 question to ask is, when you're recommended for something, whether it's a medication, a procedure, a full-blown surgery, what are my risks if I choose to do this? And what are the benefits? And that's all you need to know, the risks and the benefits. And you need to be fully informed so that you can make a decision of what's right for you. And
be aware.
Sadly, there are medical professionals out there who think they know what's best for people, and they decide what risk is worth taking. And that's not human. You shouldn't you shouldn't decide what risk someone else should take.
Right. Especially when you're treating the symptom instead of the core.
Yes.
Tell me about your books.
So I wrote my first book. It launched when the world was shut down. It launched in 2020, in I believe it was October. And I started doing online events because people couldn't get anywhere. And it's just been an amazing ride. But that book is Pain Culprits. And that book is all about explaining how everything's connected. And what I mean by that is it really focuses on the physical aspect of the body, the function of the body. And so many people get seen as a body part when they walk through the door. And I cannot tell you how many patients looked at me and were so thankful that I found something that could be addressed, because no test, no imaging, no anything would show something up. And I would say, well, that's a good thing. That means we have a really good chance of resolving this without more intervention. But they were treated like they're crazy by the medical profession because nothing can be found. And I would say, oh, you've got a sacral torsion, or this is off, or you have an upslip, or your fascia here is just glued to your lumbar spine, those kind of things. And but the book really focuses on the fact that your joints aren't isolated. And what I mean by that is, when someone has knee pain, everybody in the profession sees them as a knee that walks through the door. And it's the knee, they're not going to look above at the hip. They're not going to look below at the ankle. And the knee is a very simple hinge joint. And yes, there are some components to it that could be a little bit complex, but for the most part, it's a fairly simple joint. And it counts on what's happening in the hips and the ankles. And you're going to hear from your typical therapist, oh, I can't look at your hip, you're here for your knee. Or I can't look at your ankle, you're here for your knee. And technically, that's not accurate. And I'll explain, because a lot of people get very confused and overwhelmed when they seek treatment. So depending on the insurance that people are using. So if somebody is covered by Medicare, Medicare will not pay for the visit if a different body part is treated than what's on the prescription. However, if you are an intelligent, skilled therapist, you can document appropriately why you treated the hip to fix the knee. And you don't even have to say you treated the hip, because if you're working the muscles that cross the hip and cross the knee, you're working the muscles that impact the knee. So you just document, what you did that impacted the knee. You can say origin, there's ways that you can be extremely honest and accurate in your documentation, yet not be declined for payment. So there's a lot of things that you can do. It's the same thing with workers' compensation. And I won't get into the nightmare of that, because they do their best to not give approval. And then they give you approval for 3 sessions, and then they don't give you approval for 3 more weeks. And now the person's gone back. Yeah, that's a whole nother nightmare. But you need to be seen as a whole person. And if you go to see someone and they only see you as a body part, they only see you as a shoulder that walks in the door, or they only see you as a knee, or they only see you as a low back or a neck, they're going to be limited in how much they can help you. Because if they're not seeing you wholly, they're not going to find what I call the culprit, which is why the title of the book is Pain Culprits. Because we tend to beat up the victim, and the victim is just crying out for help.
Right.
Yeah. And so, can you fix that guy up there? Because he's not doing his job, and I'm really getting trashed here because of that. So, and I can very quickly kind of go through. So the knee very much counts on the hip function and the ankle function. And the majority of people out there have a history of some kind of an ankle issue. whether they were in gymnastics or they were a cheerleader or they were in sports, their ankle was trashed at some point in time, even if it was a mild sprain. And a lot of the times the pain stops. They feel they're recovered. They go back in the game. Nobody has assessed to make sure the ankle is working correctly. And the body's really good at compensating. And the foot and the ankle influence everything that happens in the body all the way up to the neck. It's this beautiful chain reaction that occurs. And from the time you land on your heel, before you push off your toe, this reaction happens all the way up to the neck and all the way back down with every single step you take. And so if that foot and ankle is not correct, it can impact the knees, the hips, the low back, the shoulders, even the neck.
That's fascinating.
So I had a guy who came in, his therapist was on vacation. So he got on my schedule and he had been seen for 8 or 9 conventional treatments. And by conventional, it was hot pack, ultrasound, a little massage and some range of motion. And he had neck pain. And so I'm looking at the chart and nothing had changed in his symptoms that he was reporting. I asked him, I say, well, nothing's changed. Tell me when you have your pain. And he said in the morning, he loved to take a walk in the morning. By the end of his walk, he had neck pain and a headache, but he didn't want to give up his walks. And I said, well, do you mind if we do something different? Because obviously the treatments you're getting aren't working. And he said, absolutely. He wanted to get better. So I looked at the low back because the low back and the neck, your spine is one piece of anatomy, even though we break it up, cervical, thoracic, lumbar, sacral, it's one piece of anatomy. And so I looked at the low back. There were a couple little things that I corrected, but I didn't think that was it. And so I asked him if he'd ever sprained his ankles. And he said constantly in college because he was in sports. I looked at his ankles and they were lacking. There's a range of motion that they need for proper function. They were completely lacking it. You need anywhere from 10 to 40 degrees, 30 degrees, and he was like at 0 on one and he was like minus on the other. And so when he was walking, nothing was happening correct. And by the time it got up to the neck was getting really not happy.
Yeah.
And so I restored the motion to the ankle joints and I showed him how to do a beautiful way to release the muscles that had shortened. And he never had to come back. We spoke on the phone that he said, no more neck pain, no more headaches when I walk. Now, he could have had his neck treated till the cows come home.
Yeah.
It was the victim. It wasn't the culprit.
It's just a moment, like a temporary fix, right?
Right. Yeah. Well, it wasn't even really helping him because it wasn't fixing the problem when he took a walk. Yeah. So, and the same thing with, the shoulder. The shoulders count on the really good support in the pelvis. It counts on your thoracic spine, the trunk between the neck and the low back. It counts on that to be very mobile. And a lot of the times as people age, because they don't do movement that keeps that mobility in those body areas, the shoulders can get trashed. And if somebody has a history of trauma or abuse, they're guarded. They're closed up. And that those joints are not moving well. So, and again, they can get injections in the shoulder. God forbid they can get surgery. And that's, again, the victim. So it's so important to understand you don't have to be an anatomy expert. You don't have to be a physiology expert or a biomechanics or any of that stuff. You just have to know. And when I teach this in my online events, especially, or in my online academy or the private club, people are like, this light bulb goes off. It's like, yes, I am a whole person. Yes.
Right.
And I do have pain here and there and, and people think I'm crazy and they only want to work on one body part at a time. And it's so nice when you are seen as a whole person.
Yeah.
It makes a difference.
And your history. What's coming to mind is, as a trauma therapist, I have worked with people that would do DBT, which is kind of dialectical behavioral therapy. It's like the go-to for many. And I would have clients that had done it like 7 or 8 times, and some of them had never been asked about their childhood, only about the presenting issue, right? So it's very similar. It's the system. But I do see it changing with people like us that are kind of spreading that everything is connecting. Yes. But sadly, so many people have been in that kind of system for years.
And I, because of my experience in the support group, a lot of the times I do distance consulting. I've been using Zoom since long before the world shut down. And I will ask people because I just get a sense, do you mind if I ask you a personal question? Of course, I get their permission. And then I ask, do you have a history? And 99% of the time they do.
Yeah.
just being able to share that and open up about that will help them to start. And then I'll teach them the breathing techniques to get the vagus nerve, the tone to calm, to get them out of that run from the bear mode and into the heal and repair mode. So, yeah.
What was your other book? Because you mentioned the first one.
Yeah. So my other book, because I did a little survey of the people who come to me, and it's almost a 50-50 split. Half of them come to me because they've got pain that they want to address. And I kind of teach the man to fish. I teach them how to fix their own body through movement. And of course, other strategies that are needed. Then the other half of the people come to me because they don't want to end up like they see their loved ones end up as they get older. They don't want to lose their independence. They don't want to decline. They certainly don't want to end up in a nursing home. And I've worked in home care settings, nursing care settings, and no one ever set a plan to end up there. It kind of happens by default. And so, the other half, so I wrote Aging Culprits. And the first chapter is on mindset and belief, because we've been fed a narrative for decades that we are supposed to decline as we age, that we are supposed to lose lean muscle mass, that we're supposed to have joint pain, that our bones are supposed to dissolve, the list goes on and on and on. And until you understand that most of that is kind of a lie from the pit of hell, it's not going to change, because whatever you believe, that's how you're going to live your life. Your lifestyle, your activity levels, your whatever you choose to do, if you just accept all of that is inevitable, it's going to impact your choices radically. So I wrote that book. We're not destined to have to wear disposable underwear before we go below ground. I've got a whole chapter on that. Yeah. We're not destined to get shorter and shrink and have all kinds of issues. That is not true either. So the book covers those main aging culprits, those things and I go over risks and benefits of the treatments. And very often the treatments are much worse than the symptoms. And the snowball effect can be catastrophic. So, and people need to know there's so many things they can do that are not harmful. Yeah.
Right. Yeah. Yeah. You've mentioned movement a few times. What do you normally suggest as kind of the go-to, what people should be doing to move more?
Yeah. So again, the fitness industry, the movement industry, and I feel safe to say this because I know some people who are extremely well known in that industry, and they will share that the dirty little secret is most fitness instructors have chronic pain. And
I believe that.
Yeah. And so I believe the number one reason for that isn't because they're over exercising. It's the way the bodies are being trained. And what I mean by that is the human body is designed to move in 3 planes of motion. We move forward, we move backward, we move sideways, and we turn. Now, every one of our joints will pretty much do that. Now, there's a lot of specifics that I won't make people's eyes glaze over. But the point is, most of the time, conventional exercise is in 1 plane of motion. You're just going forward and back. And unfortunately, most of the time, conventional exercise is isolating muscles. And what I mean by that is we'll get in the machine and we'll put our feet behind the little gadget there and we'll straighten our knees against resistance to isolate our quads. Now, the interesting part is there really isn't anything in life that we would need to do that movement, pushing against resistance repetitively. And so, yes, the body can do it, but what you're doing is, and I've got on my YouTube channel, I've got one of the titles is, are you training like a dead person? Because the reason people do that is most of what we understand about anatomy is from studying cadavers. And so they see, okay, the muscle attaches here and it attaches here. And if it shortens, this is the movement that happens. So this must be how this muscle works. And so let's exercise it that way.
Right.
But the funny part is our muscles work in the context of the activity that we're performing. And so your quads are actually designed to help control your body, like when you step down a curb or you go downstairs or you go to sit in a chair or you go to sit in a car. The quadriceps are actually designed to lengthen under tension and control the movement.
Okay.
So when we're training them to just shorten them with resistance, we're literally causing a lot of the million dollar word is tibiofemoral shear force, but we're causing a lot of anxiety to the knee joint. And it's the same thing with the hamstrings. People do the same thing. They're either standing up or they're laying down, and they've got that thing against their ankle, and they're bending their knee against resistance to get their hamstrings stronger.
Yeah.
And yes, when you look at a cadaver, that is how the hamstring attaches. It crosses the knee, it crosses the hip. And however, in the context, in walking, the hamstring actually helps to straighten the knee at the end of the swing of gait. And I've asked many people, what activity in real life or even in sports would we ever bend our knee against resistance repetitively? And no one's been able to tell me.
Right.
Yet that's how we train the hamstrings. Again, risking injury to the knees.
Right.
So I've worked with a lot of people who, they weren't gym rats. They didn't spend 3-4 hours a day in the gym. And I don't mean that as a slur against people who do that. It's just a common term. But the people who would spend, an hour or so at the gym 3 or 4 days a week after work or before work or whatever, those are the people who come in all the time because they got tendinosis, tendinosis, tendinopathy, because they're trying to isolate muscles and work them in a way that they're not designed to work. They'll do it, but they don't really like it.
Okay.
And they're the muscles kind of saying, okay, how come you're not allowing the rest of the team to help me do this? And here's a real simple example. When people want to work their tricep, so they put their arm like this, and they have to hold that elbow perfect, and they're pushing that weight up. Okay. Now, again, if you're going to push something up overhead that's heavy, say you got to put a heavy suitcase in the overhead compartment on an airplane, you are not going to go, oh, I got to keep my elbows right here. I got to make sure I only use my triceps. I got to make sure I don't use any other body part. I got to isolate that muscle in order. No, what you're going to do is you're going to squat down a little bit to get a fulcrum, and you're going to push through your feet using max, gluteus maximus, your power source, to help you lift that overhead. So now your triceps have everybody helping them.
Right.
And that's how our body's designed. When you go to do real things, like you're in the garden and you're picking up a bag of mulch, a heavy bag of mulch, or you're picking up a grandkid that came running at you, you are not in perfect form isolating muscles.
Right.
If you work in a factory and you're doing heavy work, my husband works for FedEx and he moves packages for hours. And he's not, I better make sure I only use my bicep. I better make sure my elbow's at 90 degrees. No. So, I'm not saying we should never work out, so I hope everybody's not hearing what I'm not saying. But we just think when you're in the gym, is this a movement that I would ever do in real life? Whether it's sports, whether it's my job. And if it is, then go ahead and work it and get it stronger. If it's not,
What are your thoughts on like yoga or Tai Chi, those kind of workouts?
Yeah. So yoga, I've worked with many people who've been injured in a yoga class, and I'm not saying it was the yoga's fault. There's different reasons. Sometimes the instructor lacks some knowledge, and so they're not teaching safety modifications, that kind of thing. Sometimes it's the person's fault because they see them do a move. And I've had patients tell me this. Yeah, they did this one move and I knew I shouldn't do it, but I didn't want to be the only one in class who didn't do it. So I did it and I hurt myself. So there's different reasons. I do know that the data shows that yoga can really help people because it can get them stronger. It can get them more flexible if they're stiff, that kind of thing. But I've also found a lot of people have what's called an asymmetry. It means they're not the same on one side of the body as they are on the other. So say their right leg is stronger or their left arm is stronger, or they've got more motion in a joint on one side than the other. So now when they go to do the yoga, and I believe they do switch sides when they do the different forms, if the person has a deficit on one side, sometimes that can cause some problems. And so there's this beautiful technique that is taught by Tom DeLonzo Baker. It's called total motion release. And the power behind it is you work what he calls the yummy side to fix the yucky side. And it's oh my gosh, it's powerful. Very, very powerful. Yeah. It can do amazing things. I had one woman who'd had surgery on her shoulder. She had a different therapist and they were on vacation. I get to play with a lot of people who it's my first time with them. And her therapist had written the notes that she was ready to start isometric strengthening, which is basically not moving the muscle, but pushing so that you're kind of waking up the muscle. And I asked her if she was open to trying something, because that arm was so injured. I mean, they hadn't even attached the clavicle here. I don't know why. She had this big 9-inch jagged scar down the back of her arm. And I said, what is that from? And she said it was from a gunshot wound.
Wow.
Now, I didn't ask her history. I didn't feel it was appropriate. But obviously that arm was traumatized. I mean, think about what that arm had been through. And so I said to her, are you willing to try something? Would you do something with your arm that has no problems? And she said, sure. I said, let's just take a few minutes. Let's see what happens. And so I had her do a couple of sets of arm raises on her happy arm. And then the unhappy arm, which she could only do to about here and was very painful initially, she could go to about here and it was less painful. And her eyes got wide and she said, okay, how did that happen? And I said, well, we'll talk about that in a minute, but usually if it works, we do it again. So she did a couple more sets on the yummy side and she could lift that arm up almost all the way to the ceiling with very little pain.
Wow.
I mean, her jaw just about dropped to the floor. Huh. And so there is so much theory around why or how that works. But the bottom line is, if you get a stroke on the right side of your brain, the left side of your body is impacted and vice versa. So there is this crossover that occurs in the brain. You've got this corpus callosum and things do cross over. But also when you're working one side, you're impacting the other side of the body. Because, if I lift this up, there's this physics thing for every action requires an equal and opposite reaction. And so when I lift this up, the other side of my body is reacting to that and stabilizing me. And so as she was working this arm, this side was getting worked, but it was getting worked in a way that kind of put it on slack and sort of made it relax and get happy. It's sort of like, if a drawer is stuck and you keep trying to pull it out, but you push it all the way back in to get it on track and then it comes out. It's kind of what you're doing. You're sort of putting yourself back on track. And it's completely painless because you're only working the yummy side. So yeah. I've seen that. Oh my gosh, I could tell you story after story about how amazing that can be. Yeah.
Amazing.
Yeah.
So you've kind of touched a little bit on emotion and the nervous system, but how do you see maybe just an overview of how they're involved in chronic pain and aging?
Yes. So if someone has trauma in their past, it changes everything, because if they have not healed, they're going to be in that run from the bear mode chronically. And that run from the bear mode causes all kinds of chemical release, even cortisol, which is essentially the stress hormone. And cortisol is really good at eating away at your hippocampus, which impacts your short-term memory. So you'll forget where you put your keys, and so that's very stressful. It will also create fat deposits in the trunk of the body. So you kind of get, I tell people, we really need to pray for those people who have the big trunks and the skinny legs and arms, because they're really stressed. They've got there's something's going on in their world. It's not just because of what they're eating. There's a lot that's happening. So, and I'm not saying everybody who has that has a history of trauma. So I don't want people to go, oh my gosh, I don't want people to think I got something wrong with me. But those emotions, the thought processes, if somebody is standing behind you in line and maybe they just tap you on the shoulder to ask you to reach something or whatever, that could trigger you because of your trauma, because it depends. I remember in the support group, there was one woman who would be triggered by laughter. And I'm thinking her abuser laughed because laughter triggered her big time. So, colors can trigger us, sights, smells, sounds. One woman was triggered by a certain cologne because, that was worn by her abuser. So, but it's going to impact, you're constantly on guard, and it will impact the expansion of your rib cage, because when you're running from the bear, you're not moving your body in a way that brings health and vitality. You're kind of curling up. It's not just fight or flight. You're ready to beat the bear up, or you're running from the bear. There's also the freeze mechanism where you are just frozen because you are terrified and you can't move. Yeah. And most of us have had that nightmare where you couldn't even yell, you couldn't open your mouth. And I mean, it can happen. And then there's fawn. And a lot of people don't know about that, but I'm very aware of that because of the support group. That's when you're terrified of your abuser and you say and do whatever you need to do to try to keep yourself safe and not get abused again. And that's the fawn. So it's not just run or fight. There's other aspects, and it's going to impact your breathing, which impacts your trunk, which can just make your ribs sort of close up. It can impact everything.
Right.
Yeah.
It's that if I make everybody happy, then I'll be okay. Yeah.
Yeah.
It
And
happens a lot
we
with
can't make
everybody's
everybody
body.
happy.
Oh God, no.
It's a losing battle.
Yeah. Yeah. How so I had explained it in my own stuff. Oops, I almost dropped my phone. With neuropeptides coming from the brain and storing on different body parts. And something's coming to me as you're talking about the pain and aging with the trauma. And what I've been seeing a lot of lately is that it's not actually organs necessarily where it stores, but through the fascia. Because originally I studied that it was like through spinal fluid and bloodstream, but now I'm hearing all this stuff about the fascia. So is it both or is it just the fascia? Like, what do you think?
So, and that's a really good question. And I can honestly state I haven't done a deep dive into the research on that recently. I do know that there is an annual fascial congress that was meeting in Florida that started a few years before the world kind of closed. And because of that, you have these experts from around the world who are now collaborating. So we're learning a lot more about that system. And I actually have trained under Sue Hitzman, who's the creator of the MELT method. She might be a perfect guest for your show, by the way.
Yeah.
She's phenomenal. She's brilliant. And she traveled around the world and interviewed all of these scientists who've been studying the system. And what they found now, back when I was in college, I did take gross anatomy. And I always tease and say it's not called gross because you're working on a dead body. It's gross because you don't need a microscope. But yeah, most people would think it is gross. But when we had to get to the structures, we were told to just get the fascia out of the way because it was considered to be like packing material, so to speak, right? That it didn't have any kind of real activity or purpose aside from just being packing material. But now we know that it actually is the good stuff.
Yeah.
And it is so fluid and it is so embedded with those proprioceptors, those nerve endings. I mean, it is an amazing system. And we can impact it through movement because all of your muscles are surrounded by the superficial aspect of the fascia. But the interesting part is, as I tell people, and I'm borrowing this from, I don't know who first said this, depending on what anatomy book you look at, we've got about 600 muscles. Some will say more, some will say less. And that's because dead bodies will have anomalies. Some will have the psoas minor and some won't, that kind of thing. And so here's the thing. We really don't have 600 muscles. We have one muscle separated by 600 compartments of fascia.
Wow. That's so cool.
So think of it that way. And I actually have a slide that I show on some of my events where you look at the cross section of the thigh. So if I took your thigh and we did a cross section, we kind of lifted the top and looked down, you would see the fascial compartments around all the muscles. It's very cool.
Yeah.
And so ignoring that system, I think, is what has sort of diminished the effect you can have on helping people because that system is so powerful.
Yeah. Again, it's kind of like how CBT, cognitive behavioral therapy, has ignored emotion and the nervous system for so long.
Yeah, because it's all about training what you think, how you think, which can be helpful. It can be a tool.
For sure.
But yeah, I agree.
It's a good foundation, but it's a very exciting time to be here and to be aware because of all they're discovering. So
yes, it is. And people don't have to be overwhelmed by all the science because it really comes down to the human body is most of us know what we need. We're just afraid to verbalize it. If we've got a history of trauma, we don't feel it's safe to say things and as you said, wanting to please everyone, wanting to make everybody around us happy and not declaring our own needs or wants or desires, which is terrible because if you don't tell people what you want, they won't know.
Right. Yeah.
So yeah. But the fascia it's a fascinating system and it surrounds everything right down to a cellular level. And it's completely connected. It's interconnected. There's no separation in that system. So the cool thing is when I teach people how to do their own fascial release and things, and it can completely change their posture in like 15 minutes. It's just phenomenal. And what happens is because the fascial system is so fluid, when we spend a lot of time sitting, we're pushing the fluid kind of out of that. So if I push here and I hold that pressure, that fluid is pushed away from that tissue. And if I hold that long enough, that tissue is going to start to be injured. It's going to not have what it needs. We all are very familiar with pressure ulcers. If somebody's in a hospital bed and they get the heel sores and they get the buttock sores and, because they can't move. And so the tissue dies and they get those wounds. But when we're sitting in a chair, obviously we shift. There isn't anybody who doesn't shift in their chair. And the reason they're shifting is because the system says, I need some fluid, get off me. And if you got somebody who's in a wheelchair and they're using like a Roho cushion to try to, and in the hospitals, they have the air cushions, which are helping people to not get injured so badly. But our fascial system needs fluid. And a lot of the times, especially as we get older, and it's not the aging process, it's time. If the person isn't doing things that really keeps them fluid and hydrated, and a lot of people stop drinking water when they're older because they don't want an accident, they don't want to have to use the bathroom. And I tell them that's how it works. Water in, water out. You got to be hydrated. You're losing muscle mass because muscles are 78% water. And if you're dehydrated, that's part of why you're losing muscle. Right. But, there's a lot. Everything's connected. So, the thing about the fascia is it's very reactive to the right kind of stimulus. So that's why myofascial release can have some really good effect, because you've got these little things in the fascia called fibroblasts, and they're kind of like little factories, and they produce everything. They produce all the fluids, and they produce the collagen fibers and the fibrin and all that. And they will produce other fibroblasts too when you stimulate them the right way. So the right kind of pressure done properly will heal the fascia. Right. And it's so much fun.
How long of how many treatments would it take to heal something like that if the person was doing the right stuff outside of treatment?
That's a really good question. And the answer is it depends. It depends on what's going on in their body, in their world. How chronic are their issues? What else is going on? Are they feeding themselves horrible? So the nutrition is not helping the body the way it needs to. There's a lot of variables for each person. And I often say that people are kind of like a fingerprint. We're all unique. Our histories, our personalities, how we interact with people, we're all unique. But there are some basic things that everyone can do that will really start the healing process. And no matter where you access the fascia, because it's all connected, the whole system will be impacted positively.
Okay. Can you give us one of those kind of basic movements that you might suggest to people?
So a lot of the times what I'll do is I'll tell people to do like a 3D breath, kind of a breakdown thing. And if you do it with your back against a chair, or maybe even take a foam roller and have that behind you and stand against a wall, just to get that impact to the spine. But if you take a hand on the chest and the stomach, and you think about the dimension of front to back. So like if you were laying on the floor, it would be ceiling to floor. But you think about, as you take a couple of breaths in, and they don't have to be the fullest breath you can take, just that dimension, you're thinking about your rib cage expanding front to back. So you take a couple of breaths in and out. And then if you put your hands, because that manual cue helps, and if you put your hands on the sides of your rib cage, and you take a couple of breaths, feeling the expansion out to the sides. And then you go for length, a hand up here and a hand down low in the center of the pelvis. And you feel that breath lengthening the spine, kind of going up into the neck and down into the pelvis. And then you kind of put it all together. It's like a 6-sided breath. And you just think depth, width, and length. When you do that, you've mobilized your thoracic spine. You've improved your diaphragm's ability to get the rib cage mobile. And that can have a huge impact on just how you feel the rest of the day.
Yeah. Fabulous.
Yeah.
Okay. I know we're almost out of time, but what if you could leave people with one message to the world, what would it be?
I think if I had to, it's funny, and I kind of want to sidetrack slightly. I had a student following me when I was doing acute care in the hospital setting, and she asked me what I thought was the most important thing for her to know. And at first I was kind of blown away because I was like, whoa. And then it immediately came to me that the patient comes first. Yeah. And she just I think she was a little disappointed with my answer, but she was young and she, was inexperienced. She was a student. She was learning. But I think we don't understand that we have immense value. We are so precious. And if we haven't received that message, or the opposite, if we don't understand our own identity
Yeah.
as a valuable being, it's going to impact what we accept into our world. It's going to impact the kind of treatment that we allow or we choose. So, I'm thinking that's one of the most important things, is to be sure that people see you as a valuable person who's
Right.
precious.
Yeah.
Yeah.
It's that I am enough.
Yes. Yes.
Yeah.
More than enough.
Yeah. Yeah.
Yes.
Where can people find you?
Well, I do have my YouTube channel, and you just have to type in my name and that'll show up. I have the main website. We've set it up where there's a simple little 5-question quiz that people can answer, and it will sort of aim them at the content, because I've literally got like 7 websites. I have one for each of my books, and one for my academy for the people who want to age well, one for the people who want to get rid of pain. And so that main website will just those simple questions, and then it will help them to navigate and where they need to go. And that is, it's kind of a long handle. It's havelifelongwellbeing.com, because I want everybody to have lifelong well-being.
Right.
And so, but that, and they can contact me there as well. Yes.
And it'll be in the show notes, but it's always good to say. Okay. Is there anything that I did not ask that you would like to put out there?
Gosh, I really can't think of anything. You had some great questions, and I'm hoping this really helped people.
Yeah, I loved the stories. It was
Yes.
amazing.
Yes.
Okay. I'm just going to stop. Thank you very much.